Why women's headaches are often misdiagnosed as migraines, how neck and muscle tension could be the real culprit. Many women walk into a healthcare office with one main complaint: I've been having headaches. Too often, the automatic response is, it's probably migraine. While migraines are common in women, not every headache is a migraine. In fact, many women are misdiagnosed, especially when the real issue is musculoskeletal in origin. Migraine versus tension headache. They are not the same. A true migraine is a neurological condition. It typically includes throbbing or pulsating pain, sensitivity to light and sound, nausea or vomiting, possible aura, visual disturbances, worsening with activity. By contrast, a tension-type headache often presents as tight, band-like pressure, pain starting in the neck or upper back, shoulder and trapezius tightness, headache that worsens with stress or posture, relief with massage, stretching, or manual therapy. Yet many women reporting headache are quickly labelled as migraine sufferers, often before a thorough musculoskeletal evaluation is performed. The pattern we frequently see. A woman presents with chronic headaches, neck tightness, upper trapezius tension, forward head posture, stress-related flare-ups. She is told, it's hormonal. It's migraine. Women are prone to this. Medication is prescribed. But then something interesting happens. She visits a chiropractor or musculoskeletal specialist. The practitioner works on cervical joint mobility, trigger points, muscle tension, postural correction, and the headaches improve. What does that tell us? If manual therapy to muscles and joints significantly reduces the headache, this strongly suggests a musculoskeletal driver. Migraines are not typically resolved simply by releasing tight trapezius muscles, improving cervical alignment, correcting posture, restoring joint mobility. When mechanical correction improves symptoms, the headache may have been misclassified from the beginning. The overlooked role of the neck. There is a third category that is frequently missed: cervicogenic headache. This type of headache originates from cervical spine dysfunction, muscle imbalance, joint restriction, postural strain. It can radiate to the temples, behind the eyes, the forehead, and it is often mistaken for migraine. Why women may be overdiagnosed with migraine. Research shows migraines are more prevalent in women, partly due to hormonal fluctuations. However, prevalence does not mean every headache is hormonal. Unfortunately, there can be cognitive bias. Female patient plus headache equals migraine. Hormones are blamed without structural assessment. Musculoskeletal examination may be minimal or absent. This leads to unnecessary medication use, long-term labeling, overlooking treatable mechanical causes. When improvement with chiropractic matters. If a patient's headache improves with muscle work, spinal adjustment, postural retraining, strengthening exercises, that clinical response is diagnostic information. It indicates the headache was likely tension type, cervicogenic, or biomechanical in origin, not a primary neurological migraine. The importance of proper evaluation. Every woman presenting with headaches deserves a thorough neurological screening, a detailed musculoskeletal exam, cervical range of motion assessment, postural analysis, trigger point evaluation. Headaches are multifactorial. Some are migraines, many are not. A balanced perspective. This is not to dismiss true migraine sufferers. Migraines are real and can be debilitating. But labeling every female headache as migraine, especially without structural evaluation, may lead to misdiagnosis and delayed appropriate care. When mechanical treatment resolves the headache, the body is telling us something. The diagnosis should match the response. Final thoughts. Women deserve individualized evaluation, not assumptions. If a headache improves with correcting muscle tension and cervical dysfunction, it was likely never just hormonal in the first place. The key question isn't, is it migraine? The better question is, what is driving this headache? And sometimes the answer is in the neck, not the hormones. Picture: